Hello, good day. So these are the data that I have gathered while watching the Gregorios Forgive Us All. Number one is has no sufficient funds to give Lisa transportation to Lowland. Next is he wasn't able to buy the medicines needed for Lisa's treatment. Third is he lost his wife and child. Fourth, Gregorio wasn't able to afford her wife and child's own funeral. Number 5 is Gregorio is suffering from emotional, physical, mental, and financial problems. So next is we have the diagnosis. The diagnosis is grieving related to loss of wife and child as evidenced by psychological distress. So these are the interventions. Number one is determine the potential for a complicated grieving response. Grieving becomes more complicated in situations like multiple losses, lack of social support, unresolved family relationships and issues, or losses as a result of violence and injustice. Next is encourage significant others to manage their own self-care needs for rest, sleep, nutrition, leisure activities, and time away from the patient. Alteration in normal activities is evident during this time of stress. Care should be taken to treat these symptoms so that emotional reconstitution is not complicated by illness. Next is acknowledge the patient need to review the loss experience. In this way, the patient and family members integrate the event into the experience. Also, communicate therapeutically with patient and family members and allow them to verbalize feelings. Sharing feelings with a healthcare provider may help the patient find significance in the experience of loss. Lastly, assess the patient's ability to make decisions. Grief may limit a person's cognitive ability that is needed in decision making and problem solving. So that's all for the Gregorius Forgive Us All data gathering, diagnosis, and interventions.